Welcome everybody, with you Dr. Magdy Abdel, consultant of infectious disease, hepatology and gastroenterology. Our topic today about peptic ulcers. We will discuss causes, diagnosis of the peptic ulcer, and also differential diagnosis, complications of peptic ulcer, treatment of peptic ulcer. So we will start by symptoms of peptic ulcer. Sometimes the patient suffer from heartburn, sometimes upper abdominal pain, nausea, bleaching, vomiting, blood in stool, weight loss, weight gain, bloating, loss of appetite, yellowing of the skin, sometimes whites of the eyes, sometimes difficulty in swallowing. So sometimes also the patient suffer from complications of peptic ulcer disease, like bleeding, perforation, ulcer perforation, blockage of the stomach. What are the causes of peptic ulcer? Sometimes Helicobacter pylori may be the cause. It is a type of bacteria. Sometimes drugs like non-steroidal anti-inflammatory drugs. Sometimes excessive smoking of tobacco. Sometimes Crohn's disease. So how to diagnose this condition? This depends on upper endoscopy, and also we will diagnose the disease by symptoms confirmed by upper endoscopy, sometimes by barium swallow. What about differential diagnosis of the disease? Sometimes we find stomach cancer, sometimes coronary heart disease, inflammation of the stomach lining, gallbladder inflammations or gallbladder stones. So what about the medications? First thing, to stop non-steroidal anti-inflammatory drugs. Stop excessive smoking, excessive alcohol consumption, and also we can give medication which help treatment of the peptic ulcer disease, like proton pump inhibitor, like H2 blockers, and antibiotics. And also we can give paracetamol as analgesic. This disease, peptic ulcer disease, is break in the lining, in the inner lining of the stomach. Sometimes also in the first part of the small intestine, duodenum. Also sometimes in the lower part of esophagus. An ulcer in the stomach is called gastric ulcer, while one in the first part of the intestine is duodenal ulcer. The most common symptoms of duodenal ulcer are waking at night with upper abdominal pain, and the upper abdominal pain that improves with eating. But with gastric ulcer, the pain may worsen with eating. The pain is often described as burning or dull ache. Other symptoms include bleaching, vomiting, weight loss, or poor appetite. About third of older people have no symptoms. In the peptic ulcer disease, we expect sometimes, if the condition not treated at the beginning, complications. So complication may include bleeding, perforation, and blockage of the stomach. Bleeding occurs in as many as 15% of the cases. Sometimes internal bleeding can occur as slow blood loss that leads to anemia, or a severe blood loss that may require hospitalization or blood transfusion. A severe blood loss may cause black or bloody vomit or black or bloody stools. A hole or perforation in a stomach wall. Peptic ulcer can eat a hole through the wall of stomach or small intestine, putting the patient at risk of serious infection of abdomen, like peritonitis. Obstruction can be occurred. Peptic ulcers can block passage of food through the digestive tract, causing the patient to become full, easily to vomit and to lose weight, either through swelling from inflammation or through scarring. Sometimes we find as a complication gastric cancer. As regards the prevention, first of thing, to protect the patient from infections. It is not clear just how Helicobacter pylori spreads, but there is some evidence that it could be transmitted from a person to person or through food and water. You can sometimes take steps to protect the patient from infection, such as Helicobacter pylori. Also, use caution with pain relievers, like non-steroidal anti-inflammatory drugs or corticosteroids in general. Sometimes this corticosteroid may lead to ulcers in the stomach, in the lining wall of the stomach, or on the lower part of the esophagus, or in the upper part of small intestines. All this lead to peptic ulcer disease. So it is very important to make diagnosis, and also in some cases we make an investigation like barium swallow. But the most important tool to diagnose peptic ulcer is upper endoscopy. So after upper endoscopy, we can diagnose the condition easily and can give the proper management. Thank you very much.